Folic acid, also known as vitamin B9, is commonly used to treat or prevent certain types of anemias caused by various factors such as poor diet, pregnancy, alcoholism, liver disease, stomach/intestinal issues, kidney dialysis, or other medical conditions. It can help relieve symptoms like unusual tiredness and diarrhea that are associated with these types of anemias. Additionally, women of childbearing age are recommended to ensure they have enough folic acid in their diet or take supplements to prevent birth defects affecting the spinal cord. Folic acid is essential for forming healthy cells, especially red blood cells. It is typically recommended to take this medication at a specific time of day and in a specific dosage, according to your healthcare provider's instructions. When it comes to using folic acid vial, it's important to follow the instructions given by your doctor. The dosage will depend on your age, medical condition, and how you respond to the treatment. If you're administering this medication at home, make sure to learn how to prepare and use it properly from your healthcare professional. Before using it, always check the vial for any particles or discoloration. If you notice either of these, do not use the liquid. And be sure to learn the proper way to store and dispose of medical supplies safely. Folic acid is generally well tolerated with very few side effects. If you experience any unusual effects, it's important to inform your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Most people who take this medication do not experience any serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. If you notice any symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help immediately. Keep in mind that this is not a complete list of possible side effects. If you notice any other effects that are not mentioned here, be sure to contact your doctor or pharmacist. In terms of daily dosage, it's important to follow your doctor's instructions. Typically, folic acid is taken once daily. The best time to take it may vary depending on your individual needs, so be sure to discuss this with your healthcare provider. Before using folic acid, it's important to talk to your doctor or pharmacist if you have any allergies or medical history of kidney disease or vitamin B12 deficiency. Folic acid may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. There is a rare risk of aluminum buildup in the body from folic acid, especially if used for a long time or in people with kidney disease. If you experience symptoms such as muscle weakness, bone pain, or mental changes, it's important to let your doctor know right away. It's important to inform your doctor or dentist about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. Folic acid is safe to take during pregnancy as directed and can help prevent certain spinal cord birth defects. It's important to consult your doctor for more details. If you are breastfeeding, folic acid can pass into breast milk. While there have been no reports of harm to nursing infants, it's important to consult your doctor before breastfeeding. Drug interactions can affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with folic acid vial include chloramphenicol, methotrexate. Folic acid may also interfere with certain lab tests, potentially causing false results. Make sure lab personnel and your doctors are aware that you are using this drug. If you suspect an overdose and the person is having severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. And in Canada, residents can call a provincial poison control center for assistance. Remember not to share this medication with others. Your doctor may require lab or medical tests, such as a complete blood count, while you are taking this medication. Make sure to keep all your medical and lab appointments. It's also a good idea to consult your doctor for more details. Folic acid can be found naturally in leafy greens, beans, organ meats like liver and kidney, and citrus fruits. It's also added to enriched bread, pasta, and cereal. If you're looking to increase your folic acid intake, consult your doctor or a dietitian for a diet plan rich in this nutrient. As for the daily dosage of folic acid, it's best to follow your doctor's instructions. Typically, adults need about 400 micrograms of folic acid per day, but this can vary depending on individual needs. It's often recommended to take folic acid in the morning with food, as this can help with absorption. Always follow your doctor's guidance on when and how to take this medication. Make sure to take each dose of this medication as directed by your doctor. If you happen to miss a dose, be sure to speak with your doctor or pharmacist immediately to get a new dosing schedule. It is important not to take a double dose to make up for the missed one. It's important to store folic acid vial at room temperature away from light. Make sure to keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's important to properly discard the product and it is expired or no longer needed. If you have any questions about proper disposal, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.